Hi, thanks for joining me to talk about hormone replacement therapy today. I'm so excited about this topic because I get a lot of questions about it. It is just a really, really hot topic. Women want their hormones in balance. And if you're a man and you're listening, you want your hormones in balance too. And I always tell people men have hormones too. But today we're talking about specifically more in the female world, the hormone replacement therapy world. So let's talk about what hormone replacement therapy is, why you might want it, why you might not want it. What are some options that don't involve hormones that help get your hormones back in balance too? So let's break that down. So HRT stands for hormone replacement therapy. And so I want to just start off by saying when I first got into functional medicine, I was pretty opposed to the use of hormones. I thought, gosh, they always raise the risk of breast cancer. You just fix all the foundational issues and things will get better, and you don't need hormones. Let's get the body in balance and the body will do what the body's supposed to do. And I will say that I am still in favor of finding out the root cause of when you say, "Oh, my hormones are out of balance, I need them fixed." If we don't fix all the foundational issues that contributed to the problem, then we have a big problem. We're just throwing hormones into the mix. And sometimes in the short term that makes you feel better, but in the long term it creates a hormone soup mess that is just not really good. So I am still in favor of doing all of the groundwork and really finding out why the hormones misbehaved in the first place. But over the years, I have learned that there are some cases where women actually do need some hormone. And there is almost nobody that is doing a good job of this. Like they're going to see their primary care docs and their OBs, and they're just saying, like, oh, here, we'll give you some, estrogen or whatever. They're not testing these people properly, and they're using synthetic hormones. So when you use synthetic hormones like synthetic estrogens or progestins or something like that, the synthetic estrogens, the source of those, if you don't know this, is horse urine, pregnant horse urine. One of the trade names of is Premarin. It stands for pregnant mare urine. So people come to me and they're like, yeah, I had a hysterectomy 20 years ago and they stuck me on estradiol, whether it's a patch or a pill or a cream or whatever. And they haven't monitored my estrogen levels in 20 years, but I'm on this. And then we run their hormone levels and their estrogen levels are sky high, like so high that they are at a risk for developing breast cancer later. So I think the first thing is that it has to be done properly. So let's unpack this. Is first things first. If someone comes to me and says, "Look, entering menopause. I'm 48, I'm 49, I'm 52, whatever, and I'm hot flashing and this and that." We have to figure out what what is going on so we know. So that starts with good testing. And if you missed last week's episode where I broke down the ways to test hormones, there's 3 ways to do it. There's a good, better, and best way to do it. We get different levels of information when we test on the blood, the saliva, and the urine. So depends on what your symptoms are, depends on what your budget is, depends on what you're looking for. We pick the right thing. So we test the hormones, so we know what's going on with the hormones, but then we also test all the things that contribute to hormonal health, because sometimes that you feel like the symptoms are hormonal, but maybe they're not. For example, blood sugar fluctuations and swings. It is not that uncommon for women to have like a sense of panic or almost like a feeling of a hot flash if their blood sugar is dropping and they're going hypoglycemic. So to throw a hormonal solution at that when it's really a blood sugar situation would not be wisdom. So we part of my hormone evaluation or any evaluation that I do is looking at all the systems in the body, because we function as a whole unit. We don't just want to treat the hormones and stick them in a box. We want to look at what's your blood sugar doing? How's that doing? The other foundational piece of that is the adrenal glands. And maybe you've heard of something called adrenal fatigue, and you're thinking, gosh, I've been treating my adrenal fatigue for 10 years and it never gets any better. that's another conversation, and we need to talk if that's true, because I see that a lot. But know this: as you transition from cycling into menopause, your adrenal systems back up your ovaries. Think of it this way: your ovaries are a monthly paycheck. They secrete estrogen and progesterone and every month while they're working, but then they start to retire, and you need a 401k plan. The 401k plan is your adrenal system, but it better be working right because if you've taxed it out dealing with stress and blood blood sugar swings all over the place, which is the number one reason why women can't recover from adrenal fatigue, is because their blood sugar is all over the place. But getting the blood sugar in check and supporting and knowing what the adrenals are doing. Because if your ovaries go to retire and they take the paycheck with them, but you don't have the 401k to back it up, that's when you're like, wow, I felt really good until boom, I hit 45 and like the wheels are falling off the bus. I'm hot flashing and I have all this weight gain and I just don't feel like myself. And you were fine until all of a sudden you needed to rely on that 401k more and more, and it's not there. So that's the connection with the adrenals and the hormones. And again, you can go and throw hormones at it, but it may not be a hormonal issue. So that's the first thing is let's get clarity on what the hormones are doing. Let's get clarity on what all the other contributing factors that play into hormone health, what are those doing? Because a lot of times people's hormones feel better when we don't even do anything with the hormones. We just do stabilize the blood sugar, work on the adrenals. And then another thing that we really have to look at is the liver, because the liver's job is to help clear and metabolize and take out the trash on hormone metabolites. As your body uses and does things with hormones and breaks them down, your liver has to get rid of them and metabolize them out. And so if we have a liver that is backed up and clogged up and not doing the things that it can do, I see this quite a bit with estrogen dominance. So that would be like younger women that are still very much in their cycling years, and they're doing the cycling thing to where they're having heavy bleeding and longer periods and a lot of cramping, and the estrogen feels higher than progesterone, and it's dominant. And it's because they're not methylating, or they're not breaking down these things, and it's a liver clearance issue. So supporting the liver becomes a big deal. You can also start to see this as estrogen stays pretty level until really menopause. It just decreases more slowly than progesterone. Progesterone will just sort of start to tank at 35, and it goes down a lot faster. So there's a bigger gap of estrogen relative to progesterone. And then if you're having a hard time metabolizing that out in the liver and things like that, then you want to consider all of that. So that's why it's so important to look at the whole picture with hormones. But then back to this discussion of hormone replacement therapy. So I am not a fan of the synthetic hormones. I don't like them in the birth control pills. I don't like them in hormone replacement therapy. And the number one reason I don't like the synthetics in hormone replacement therapy is because most of the time the estrogen is oral estrogen, and oral estrogen it's harder and less efficient. It takes more load on the liver. So we talked about that kind of playing into this, and liver clearance being an issue. So I believe there are much safer ways to use if you're using if you need to use estrogen with somebody, then there are safer ways to do it. And that's where bioidentical hormones come in. Those are hormones that are made out of plants that look very much like what your body produces. They're bioidentical. So they're and the risk profile on those, if you study the research, the scary studies that link use of hormones are usually oral estrogens combined with synthetic progestin, which is a synthetic form of progesterone, and they're taken orally. That's the ones that up the risk of estrogen sensitive cancers like breast cancer, ovarian, uterine, things like that. So I think that already making a switch from a synthetic to a bioidentical is a huge win. And then the other thing is using them strategically. So you can't take the approach of, okay, here's where a woman's hormone levels should be. Here's where they are. I am going to grab an oral estrogen or a synthetic estrogen, and I'm going to give them enough to get their levels back up to where they want to be. Now, if you dose it like that and you do hormone replacement therapy that way, then what you do is you come at them with a dose that will put them where they need to be, but it will downregulate what their body's already producing. So that's the kind of the traditional way that hormone replacement therapy of any sort is done. It's how the thyroid is managed medically. It's how HRT is managed. Anytime you're looking at a hormone. So what you do is you essentially work. You're not really working with someone's body. You're coming at overpowering it and saying they need this level of a hormone, so I'm going to give them a dose that's going to put them there. A more functional, and I think a better way to do it, is to say, okay, here's where their hormone levels would be. Here's where they should be. I'm going to just give them just a little dose, a micro dose of the hormone to boost what they're already doing, so that I'm not overpowering. And then that way, if they stop taking that hormone, they don't feel like a train wreck. And it's like, wait a minute, I went from taking everything I need of this hormone in it, some kind of outside exogenous outside source, but she just gave me like just a little bit, so that my body's still going to do what it can do, but I'm just coming along and I'm bumping up and making up the difference. So that's a different approach to hormones, and that's the one I take if I have to go there with people, is that we try to just bridge the gap instead of overpowering and overwhelming. So that's where I think there's a difference, is use the smallest dose you can just to help and encourage the body to get up to where it needs to be, and then use a bioidentical. And the space where I feel like it makes a lot of sense to consider using actual bioidentical hormone replacement is when someone's had a hysterectomy, number one, especially if the ovaries have been removed, because it's such a hard transition to go from you have everything to those things are removed. And that's just a brutal way for a woman to enter menopause, to say it, bluntly, because I see this all the time. Women, they think, oh, I had all these problems and they told me they would get better if I had a hysterectomy. And then they come in here and they're like, it's not better. So if that's you and you want to try something before you have a hysterectomy, that's a great time for us to connect too, is what can be done before it gets to that point. But if you've already had that done, I mean, sometimes it is really good to use a little bit of those bioidenticals, because you just really, there are so many problems with having a hysterectomy that are just not explained well, I feel like, to women. Because if you don't have the ovaries anymore, you can't stimulate. If you're looking for an alternative to actual hormones, there's a lot of herbs that you can use. And this is my first choice when working with people, is can we use herbs and things like that just to stimulate the body to make a little bit more? If, say, you're going through perimenopause and you're having some hot flashes, well, can we just give you some herbs to help your body make a little more estrogen? It works beautifully if you still have your ovaries. But if you don't have any ovaries, then I can stimulate those all day long, but they're not there anymore. So it doesn't work. So just to say, like, this is all a very individual case by case thing. And then, of course, if you're a doctor that's trying to do the best for your patients, you talk to them and you communicate with them. You get a proper health history, and you look at, do they have increased risk factors for breast cancer? Did all of the women in their family have breast cancer? Well, they might want to stay away from anything hormonal and just do some herbal stuff and some plant-based alternatives that don't actually have hormone in them. So that I feel like that's a good discussion. So just in the way of recapping, um, a couple of highlights is know your levels. Like testing is everything when it comes to the hormones, because they really do need to be like Goldilocks. They need to be just right. So again, last week I talked about some of the options on hormone testing. There's 3 ways to test hormones: blood, saliva, and urine. They all have strengths and weaknesses, so that's a great resource for that. And then look at all of the contributing factors. What foundational issues affect your hormones? We talked about liver clearance, we talked about blood sugar, adrenals. Those are the 3 biggies. Inflammation would also be, I didn't talk about that, but if you have a lot of inflammation, what you do is inflammation makes receptor sites for hormones like gummed up and gunked up. And so sometimes the right amount of hormone can't get in to cells. It's a signaling issue that's disrupted by inflammation. So things like that, if you've got sky high inflammation and your hormones aren't behaving, then you also need to address that. And then picking the right solution for you that is appropriate for you. Like, do you still have all the parts and they just need to be like kind of stimulated to produce what they need to produce? Or do you not? Have you had a hysterectomy? In which case you might want to consider some bioidenticals, because you can stimulate something all day long, but it's not there anymore. So anyway, just a little recap. If you have a question, put it in the chat. I'm looking over the chat right here, right now. Or if you are watching this after the fact and you have a comment, I try my best to answer any questions that you have on this. But I wanted to present some good information on hormone replacement, because boy, is it a hot topic. And I feel like there's these little centers popping up all over the place. It's like, hey, just go, phone in and we'll give you some hormone replacement therapy. That's on the side for men and women. And sometimes I get those people that come to me that said, I tried that and it just, like, I felt great for 2 or 3 months, but then I didn't, because like we talked about, is you're giving someone so much hormone, you're kind of shutting down what they're already doing and not working with the body. And that I feel like that is an easier way for practitioners to approach HRT, is just have a quick little conversation with you. Okay, here, you're this age and you got this going on. Well, just, you mostly need progesterone at this age, and maybe a little estrogen, and it's a one size fits all, versus like really sitting down and getting to know somebody and asking them what they're looking for, and finding out what all the other contributing things are, and looking at the whole picture, getting the labs that cover all the systems, not just the hormones, so we know what's contributing. I feel like that's the right answer. So shoot the questions in the comments if you have them, or if you're like, hey, I need to talk to you personally about how I go through this process for me. I've got hot flashes or perimenopause or hormonal weight gain or whatever, I can't sleep. That's a lot of times that's a progesterone issue, or whatever it is. And you want to schedule it. I call it a discovery call, where I just give you a phone call. We talk for a few minutes. You tell me what's going on, and I listen and say, hey, this is the process I would go through with you, and answer your questions. And then if that's right for you, we move on from there. And if not, that's okay too. But that's a discovery call. And so we put a link in that too. If you want to talk to me, I'd be glad to talk to you. Okay, thanks for spending a few minutes with me, and have a great rest of your day.